Well, good evening, everyone. This is Dr. Joseph Kanu, broadcasting live from Rochester Chiropractic Clinic, and it is Wednesday, and Wednesday is Dr. Haddad Nights. So we call them nights, days. What is it, anyways?
I don't know. It's night today, but
in some parts of the world, it's days.
This is true.
It could be morning.
I'm just happy to be part of it. I don't care what you call it. Whatever,
well,
whatever floats your boat.
For our listeners in Australia, good morning, okay?
Very nice.
Anyways.
Good day, mate.
Yes.
Great to be here.
Yeah.
I have a special guest tonight, actually, and you may have heard her just giggle there.
Yes.
I actually, in the past, I've brought a patient on before, which I thought I got such a great response from because people want to hear real stories. I can talk all I want, but to hear it from the person who's actually been treated and explain it in layman's terms is powerful. And so Rachel is even more special than a patient because not only is she a patient, but she is my assistant and has been pretty much for the beginning of my career. So
for your whole career. Wow. Rachel has worked on me.
Yes, she has.
She was wonderful.
Rachel,
very
welcome.
Warm.
Thank you.
And
this is radio. You have to talk.
Yes. She's used to just nodding.
I am a talker, so you better watch out.
I usually just don't give her the chance, unfortunately, because I'm talking too much. But, Rachel is a very interesting case. We've talked in the past, and it's been a while, actually, about TMJ pain and migraine pain and headaches and how a lot of these things all go hand in hand with a improper bite. And Rachel has not only started in pain, which was a couple years ago, but literally finished her treatment a couple weeks ago.
Wow.
And I want to explain.
This is after working for 11 years.
Yes.
And I'm glad you brought that up because you think about that. She watched me treat people for over 9 years. And I heard her over the 9 years talk about her migraines, talk about, I have a bad headache. And shame on me, but sometimes it's right in front of you.
The shoemaker's kid needs new shoes, right?
Yeah.
The plumber's wife has a leaky faucet.
I love it. It's exactly. Our loved ones get forgotten, right? And so, thank God, it was. One day we had an opening. Actually, is really what it come down to. And I said, Rachel, let's just take a look. We had nothing to do. I said, hey, let's take a look at you.
Doesn't he? That's bad when the doctor has nothing. You got to keep him busy. My staff, if there's not a patient there, they hate it because I get like, all right, what's going on?
God was looking out for me that day and wanted me to be seen.
This is true because I'll tell you, when I finally looked in her mouth, I realized, she's classic. She's a classic person. And she has beautiful teeth. You're looking at her teeth right now. And most people who have these broken down bites, their teeth aren't that beautiful. They've had years and years of wear and tear, and they're severely broken down. But what this goes to show you is that people who have, arguably a very nice smile could still have a very poor jaw position and a poor bite.
Wow.
And that's what Rachel had. And so, we started from the beginning, and I feel like that's what we should do, really, and kind of recap
from the beginning
about what TMJ is.
What is TMJ? Hey, Jeff, that's what we need to cover that. We haven't covered that since October.
It's been a long time, and to be honest, it's really one of the big focuses in our office. We treat people who are in daily pain every single day, and it's one of my favorite and most fulfilling
topics.
Services. And I enjoy it because these people aren't living life. They are, Rachel, you think about that. You lived on, and Dr. Joe is going to really get pumped up about this. Tell him what your daily to weekly routine was for medications before we get started about what a TMJ is.
Well, I thought that I had sinus headaches every single day. So I used Advil Cold and Sinus every single day.
Wow.
And
every single day.
Yeah, not only is it expensive, but But
you do know 20,000 people die every year in America. 20,000 every year from Advil, Motrin, the over-the-counter, Aleve, the NSAIDs.
Yep.
Wow. Yeah, well, you know what, Jeff? Let's go to a prayer.
Okay.
Now that we've introduced the show, we're going to talk about TMJ.
And we thanked God already for me looking at Rachel's mouth, so let's do it properly.
And Rachel, we really thank you for coming on the air, dedicating your time. Rachel is the mother of 2 little kids.
Correct.
And is dedicating her time tonight to be on the air. Thank you.
You're welcome.
Very much for
I'm
that.
pretty passionate about it because he saved my life.
Yeah.
So.
Well, it's nice to have life abundantly.
Yes.
Right?
Yes.
Okay, so we're going to read from Ecclesiastes tonight. And there's 3 of us here tonight. So, and this is a scripture in Ecclesiastes chapter 4. And it has to do with 2 are better than 1. You know, where 2 or 3 are gathered, Jesus is present amongst us. And it's wonderful numbers. As Christians, we need to fellowship. Jesus always sent the apostles out 2 by 2. He didn't send them out individually. It's important that we go out either 2 or 3, where 2 or 3 are gathered. Okay, 2 are better than 1. They get a good wage for their labor. If one falls, the other will lift him up or her up. And woe to the solitary man. If he should fall, he has no one to lift him. So also, if 2 sleep together, they keep each other warm. How can one alone keep warm? Right? Where a lone man may be overcome, 2 can resist. A 3-ply cord is not easily broken. I love that one, where 3-ply. The number 3 is a very important biblical number and scientific number. In science, 3, the number 3. So here we are, the 3 of us. We're dedicating this show to you, Almighty God. Guide our tongues and our words and our thoughts, and bless all the listeners in Jesus' name. Amen.
Amen.
Okay, so we're going to talk about TMJ, Jeff.
Correct.
I'm excited about that.
Yeah, well,
not cosmetics.
No.
I just wanted to.
No, we're not. Although, look at that beautiful smile.
It's a beautiful
Come on.
smile, yes.
You know, I told you, form follows function. And no, we're not going to talk about cosmetics. But I want to even get past this TMJ word, because
what is,
well, first of all,
what does that stand for?
TMJ means the temporomandibular joint, and that's where your lower jaw meets your skull. Okay, that's really it. I mean, your lower jaw is literally held in by muscles. If I cut the muscles of your face, your lower jaw would hit the floor. Okay, it's a very unique joint. It's unlike no other joint in your body. And what people don't realize is that it's not people just because we say you have a temporomandibular joint disorder or a TMJ disorder. It's also referred to as TMD. It has nothing to do with the joint 90% of the time. 90% of the time, it's a muscular problem. And that is why I don't want people to concentrate on that word, the joint, because when you're talking about muscular problems, that's where headaches and migraines overlap in this syndrome, because the majority of headaches are muscular tension headaches. Even migraines. Many migraines are misdiagnosed. And obviously, Rachel's were misdiagnosed because I can't cure true migraines, okay? I'm not going to claim to tell you that I can. The problem is most people throw that word around too easily. Rachel was told she had migraines. What was your drug of choice when you had a bad migraine, Rachel? Imitrex. That's everybody's, okay? That is something that is it's the most popular drug out there. And when you have a migraine, you take your Imitrex, and it's a very powerful drug. And when we looked at Rachel and realized that she may have a bite problem, we decided that we need to address things conservatively, which is what we do, like I do with all of my pain patients. And I guess the thing that I want people who are listening to get through their head is, if you're having headaches, okay, if you've been told you have migraines and you are only taking medication to take care of things, this treatment may be very appropriate for you. I mean, Rachel, you know, again, I'm going to let you talk here, because really it's more powerful coming from you. How many patients do we see that have seen every other doctor they thought of, have been on medications forever, and unfortunately, we're the last ones on the totem pole to be seen a lot of times. But how many of these people do we treat and fix?
Pretty much 100%.
Yes, and it's not because we can treat everybody, Joe. I don't want anybody to think I can fix anybody, but we have consultations specifically to see if you are a candidate for this treatment. I would never want anybody to have false hope. I don't want to waste my time, and I don't want to waste their time.
Sure.
So we do a very thorough examination, which, Dr. Joe, we've gone through with you, so you know how we do it.
Yes.
And we can tell you right then and there.
That's important.
Yes, we can help you, or no, we can't. And
So you only accept cases that you know you can help.
That's correct.
That's why you have the high percentage.
I strive to succeed. I am not going to set myself up for failure, and I don't want to let one of my patients down. So if I can't help you, I'm going to tell you. But there are very distinct measurements and ways for us to measure the actual person to tell if they are a candidate or not. Okay, and that's what we did for Rachel. And I guess let's start
Jeff,
from the beginning.
Can we? Yeah. So what are the symptoms of TMJ? How do you know if a listener out there says, how do I know if I have TMJ?
Okay.
What are the symptoms?
I think one of the number ones is headaches, to be honest. Daily headaches and neck pain, okay?
Okay.
These are and again, that's where a lot of this overlaps with you, too. Lower, upper neck pain, upper cervical tension, that all translates into a poor
That's
jaw
kind of what
posture.
Angelo does, right?
That's
the tension.
That's correct.
In the shoulders.
Correct. And so,
is it neck? Is it from the jaw? What is it? Hormonal?
Chicken or the egg, right?
Yes.
But
right.
so that's daily headaches for sure. Noise in your joints. If you open and it clicks and it pops and things like that, that's not good.
How about locking?
Absolutely locking. No question about it. Jaw pain in general. There's a lot of muscles around this, these joints, and that's a big problem. Now, here's something that you would never think would be related to your jaw or your joint. Ear symptoms. Ear congestion. Ear ringing. Okay, tinnitus.
Mm-hmm.
Rachel had a great point about her sinuses. Do you have any idea how many people just chalk up pain in their frontal, under the eyes and everything, cheeks, to sinus pain? If you don't have drainage coming out of your nose, it's not a sinus infection. It's not sinus pressure caused from an infection. It could very well be a muscular problem that just happens to be right over your sinuses. So these are a lot of things. Another good one's vertigo, dizziness.
Boy.
You think about
this.
See
a lot of that.
Yeah, well, if you have that tension right around that joint is literally right in front of your ear. And when you have nerve impingement or blood supply cut off to the inner ear, then you can have dizziness and vertigo problems. So this umbrella of symptoms is big. But those are the big main symptoms I see. The other one that I see that doesn't necessarily mean you have a TMJ problem, but can definitely lead you down that path, is a clenching and grinding problem. Okay? Clenching and grinding, yes, goes hand in hand with TMJ. Doesn't mean you have a problem, but you have the high potential of becoming a Rachel, which is somebody who dealt with pain, migraines. What would you say, Rachel? How often were you getting migraines?
Really bad migraines, probably 3 times a month, but I had a headache every single day.
You had a headache every day. What part of your head hurt?
Like my sinus area, I would get it. The bad headaches would be on the left side.
Was it a throbbing, achy, foggy feeling?
Yeah. It was just like a dull ache. Yeah.
So always there.
Always
and what
there.
would you say your quality of life was? Because I know you, as well as anybody, and I mean, this is a very happy, perky person. Mm-hmm. And the days that you had your bad headaches, you weren't yourself, right?
I was, pretty much a sulker. Like, I came in, did my job, and was just looking forward to going home. And it made me sad because I have a very active 5-year-old that needed her mommy, and I would just come home and want to sit on the couch. And now
That's pretty frustrating, too, isn't it?
Yeah, yep. So, I mean, he definitely changed my life by fixing me, so...
So, so what we do
to
fix people...
So what finally tipped you off, Dr. Jeff, with Rachel's case?
The main thing was when I looked at her bite, her lower jaw was way too far back. Okay, she had a very big overbite for the most part, and that's a very common sign that we see with a poor destructive bite that causes these symptoms, is an overbite. People who have overbites have a high potential to be thrown into this downward spiral, pain situation.
Now, is this the muscles retracting the lower jaw, or is the bone actually shorter?
Actually, it's the teeth. So there's 3 things that dictate your bite. Your teeth, the muscles of your face, and your joints. Okay? Your teeth dominate the entire situation. So what it was that the way her teeth interlocked was forcing her jaw backwards, which meant that the muscles and the joints had to accommodate. And they accommodated at a price, which is pain. Mm-hmm. And so what we do is we treat the muscles, which we talked about earlier. Is 90% of the pain is muscular. So what we do is we relax those muscles. We use a TENS unit, which is a low-level massager, if you will. We'll keep it very simple. And it relaxes the muscles. It gets that lactic acid buildup, that tension out of there. And allows your jaw to go free into the position that your body wants it to be. And then we make an impression of that spot. And then we build an appliance that will essentially resurface your lower teeth, tricking your body, if you will, to thinking that your teeth fit together in this proper position.
In a relaxed position.
That's correct.
Right? And I had to say something about the orthotic. It's a big piece of hunky plastic. And when he gave it to me, I'm like, I am not going to be able to wear this. And I wore it for a little bit, and he would catch me with it out, and he'd say, put it back in, and I would put it back in, and then I just got used to it.
So
and
it took you
it took me a little bit.
Couple weeks.
Yeah, just a couple weeks. Yep. It wasn't anything hard to get used to. And once I just put my mind to it that I was going to do it, and by 2 weeks probably, when I would take it out, I would be in instant pain within 15 minutes of taking it out. As soon as I put it back in, my headache would be gone.
Wow.
Yeah.
So that was pretty instant.
And I have to say another thing, too. I know that you guys have talked about the CT scan, and we took a CT scan of me, and because my jaw was so far back, my airway was cut off.
Ooh, I forgot about that.
Yeah. And we then took a CT scan with the orthotic in place, and my airway was totally open.
And we talked about this before, Joe. TMJ and sleep apnea are very, very, very related. And so, yes, her jaw was so far back that it was literally shortening or closing off her airway. And what does that lead to? That leads to big time problems, life and death
sleep
consequences.
Apnea,
sleep apnea,
decreased oxygen.
Yep.
Right.
So there goes your energy level in the toilet.
You got it. You got it. And so it's interesting.
You have a 5-year-old to chase around. So
right.
You got it. And so Rachel, when she started wearing this, and people are probably sitting here thinking, well, I don't understand. Why, when you took it out, why did the pain come back? I don't understand. Well, people who have bad bites are walking around all day long trying to keep their jaw in this position. They don't realize that it's all involuntary, but they're kind of forced in this poor position. Here's a good analogy. If you were a runner, Dr. Joe, all right, and when you ran, you had a knee problem. It hurt. But you put your knee brace on and it didn't hurt, that makes sense, right?
Sure.
And if you took it off and ran with it, it would hurt again. Think about this. This is literally giving you your muscles a break. It's giving your body a support that is going to give the jaw something to comfortably rest into without you having to think about it and struggle against it. And that's what it does. And
so you're not constantly fighting.
Exactly. And that's unfortunate what TMJ patients do. People who have bad bites, they have no idea they have a bad bite, of course. They're eating, they're fine. But what they don't realize is when we give them a comfortable bite and they come together in this appliance, it's like, oh my gosh, this feels great. And we just gave it to them. Mm-hmm. I mean, you give somebody a brand new appliance in their mouth, you shouldn't feel like it's normal. But the reason that it feels normal is because we determined that bite based on their own muscle readings. And that's going to segue into what we're going to talk about, too. People are saying, well, how do you do that?
How do you do that?
Well, we hooked you up to it, right?
Right.
The K7.
Actually, I do know how you do that.
Right.
But anyways.
And so, well, Joe, why don't you explain?
Because I had it
done
to me.
Mm-hmm.
And when I had this, the K9.
The K7.
K7, I know.
We don't have dogs in our office.
Oh, he's always giving me a hard
The
time.
K7 jaw extrapolator.
Yep, jaw tracking. I like it, yeah. I like good word.
Well, you hooked me up to it.
Uh-huh.
And I will say this, when I was hooked up to it and Jeff said, okay, now relax your jaw into this, move it forward. And I knew without him telling, without the machine showing us that it was good. But it was neat that the machine conferred with my thoughts, my instinctive.
Exactly.
My instinct was, because you sort of made a correction.
Mm-hmm.
You made like 3 adjustments.
Yep.
And then it was like the first one you did was like, no, it's not quite there yet.
Right.
And then finally when I went, and I was hoping you were going to do the second one, and that's what you chose.
That's correct.
Your machine chose it, and my instinct, I like to feel like you're in touch with your body.
Of course.
Right? If you're in touch with the spirit or your innate intelligence, whatever you want to call it, your instinct, I knew that the first time you did it, it was like, oh no, it's not quite there yet.
And you know what's so interesting about that? And I want people to understand how precise this is. We're talking half a millimeter off. That's how exact this is. But you knew it, and that's why people who have a bite that even is just a touch off, a person like Rachel, who even though she had a very drastic bite, she has beautiful teeth. You can have a nice smile and nice teeth and still have a bite problem. And you even knew it. I mean, literally, Joe, your those 2 bites that we took were, I mean, we're talking microns, okay, off.
And either one would have helped, but one was just better than the other.
No question about it.
That's why I was so impressed with the machine, Rachel. I think you were there when I was like, how did the machine know what I was thinking?
Based completely on your comfortable muscles. That's all it is.
Because it's actually reading millivolts, right, of muscle contraction.
That's correct. Yep. So it's literally following your jaw, and when it's in the most relaxed position, that's where I see it on screen, and that's where I make my registration, and that's where we make this appliance.
So this machine actually, the brain and the spinal cord is electric, as we talked about. We run on electricity. Your muscles contract with electrical impulses, and this machine is picking up the electrical impulses in your muscles.
Surface EMGs.
Surface, electromyogram, myo means muscle, right? So it's calm. When the muscle is calm, it's not firing, and your machine is picking that up in real time.
You got it. I mean, I couldn't do this without this instrumentation or the training that I have. I mean, I've been doing this ever since I've been out of dental school, and it was because in dental school...
You're the only dentist I know who's doing this.
There are very few.
I mean, I know there's got to be others.
Oh, there are.
I mean, and I know hundreds of dentists, but you are the only one that I know. Well, that's if I was a dentist, I would be using that machine.
Yeah. Well, you know what helps? I mean, listen, technology is amazing, and having the proper training is important. And so what we did really with Rachel was we found this proper bite, we proved it, okay? And Rachel, you said after a couple weeks you're feeling good.
Yeah.
Refresh my memory. Was it maybe a couple months when you really felt, symptom-free? I mean, is that where we're at?
I actually felt it right away. I mean, within a month, I knew that's what was right for me. Yeah, that was right for me. And
after having headaches for years, taking Tylenol pain medication for years, daily.
Yep.
Wow,
and so then we moved me into, I was going into braces, and I don't even know if I've ever told you this, but I was scared to death because I was so comfortable in this orthotic that I didn't want to give it up.
You didn't want to change.
I didn't want to give it up. It was like my blanket, and
it was your whoopee.
Yeah, and the day we cut my orthotic off, I seriously wanted to cry because I'm like, that thing has been a part of me for 9 months. I wore mine for 9 months just because we didn't know exactly what we were going to be doing with me. But I went through the braces and it was perfect. They kept me comfortable the entire time. Anything that I felt, he knew how to fix. I'd say, I'm feeling a little pain in this tooth, and he would adjust it a little bit, and everything would be perfect. I was in ortho for 11 months, and I feel amazing.
I
feel amazing.
Let's back up a little bit here.
You put her into braces.
Well, and here's the choices you have. Okay, let's back up a little bit. The first step is getting people out of pain. Okay, that is my first goal. That's what we call phase 1. We want somebody to wear this appliance. It's a 24/7 wearing of the appliance. You're going to take it out to eat. Okay, I tell people it's about a 3 to 4 month process. You could feel great like Rachel after a month, or it may take a few months. Every person's different. Yeah. But we plan on that. Once we get you comfortable, we've got some choices. You can continue to wear this appliance forever, okay? I mean, you can wear it as needed. You can wear it as your knee brace, Wean yourself off it, wear it at night. That's fine. I've done my job. I'm thrilled. You're back to living life, and you're happy.
You're off the medication.
Exactly. Or you can choose, like Rachel did, to move your teeth or rebuild your teeth to this proper position permanently. She has beautiful teeth. She has barely any dental work. I'm not going to put any dental work in her mouth, because again, me, I want to be conservative. So braces was the best option for Rachel. We just moved her beautiful teeth into this proper position. Now she's got the beautiful smile to match that pain-free bite.
Pain-free bite without wearing the appliance anymore.
And she has no appliance anymore. She lives her life. I mean, she's walking around right now essentially where her appliance was, but her real teeth are meeting. It's the way God intended her to be. That's bottom line. That is really what we're talking about here.
Yes.
And it's powerful, and we see it every day. And I just feel terrible that I ignored.
It took so long.
I ignored this poor girl for so long. And
I'm only in your face for how many hours a day?
Yeah.
Now, why don't you explain? Let's end it with this, Rachel. Let's end on a positive note, okay? I'm going to deter away from me, my neglect, but because you know what we do for other patients and going through it yourself, what is the best thing you could talk to other headache patients about your process, how it went? What did you feel? Was it easy?
It was easy. I was a little nervous at the beginning.
Skeptical.
And, I've watched this happen for 9 years, and now I actually know how to talk to my patients and say, hey, I know what you're feeling.
Yes, you went through it.
Yeah, exactly.
Firsthand.
Yep.
They'll confide in you.
And so patients ask for me, and they want me to, I'm feeling this. Is this normal? And I'm able to tell them because I went through it. Yeah. And, they all appreciate that because they're feeling the same thing I felt.
Yes. It's always, you're going to bless others through this whole experience.
Yeah.
Mm-hmm. Yeah. Anyways, we are out of time, Dr. Jeff.
So much fun.
If you guys want to listen to this show again, you can go on simpletruthsforhealthyliving.com and listen to this show. You can reach Dr. Jeff
at 248-656-2020. Again, for those of you who have had any symptoms like Rachel, give us the opportunity to at least see you, and we'll tell you if we can help you. We do consultations for TMJ pain every single day. It's my pleasure. I would like to have the chance to at least let you know if we can help you. At that point, it's your choice, but we have a lot of people that don't think they can be helped by anybody else, and we've helped them.
Yeah. Well, thanks very much for being on the show. God bless you, Rachel.
Thank you.
And your 2 kids. Thank you, Dr. Jeff.
Thank you for having us.
God bless
we appreciate
you and your whole family. And remember, in all that you do, eat or drink, do all things to the glory of God.
Want to make a difference? Then help build a home for a deserving family. Last year, Life Remodeled, a nonprofit based here, built 4 houses in Metro Detroit, each in just 6 days. They also beautified their neighborhoods and provided the families with financial, family, and spiritual counseling, all with volunteers. They're doing it again this summer in the city of Detroit, building a house for a family in need and beautifying 48 city blocks. So save the dates, July 29th through August 4th. Everyone can help, whether you're skilled as a tradesman, hospitality, cleanup, or a prayer warrior. For more information, go to liferemodeled.com. That's liferemodeled.com. Are you self-conscious when smiling for pictures? Do you ever cover your mouth when you laugh to hide your teeth? Do you want to regain that healthy, youthful smile you used to have? Maybe it's time to finally invest in yourself and transform your teeth into the beautiful smile you've always wanted. At Rochester Advanced Dentistry, you could have the smile of your dreams, a confident and healthy smile. With the latest techniques in porcelain veneers and dental implants, Rochester Advanced Dentistry will change your life. For more information, visit RochesterAdvancedDentistry.com or call Rochester Advanced Dentistry at 248-656-2020. 248-656-2020. You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.